Hello and welcome to Healthy Living, brought to you by Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about home-based care. We'll learn about home health care, hospice care, and palliative care. We're going to start first with Christine Caffery, Home Health Patient Coordinator, who'll talk with us about home health care services from Tammany Health System. Welcome to the show, Christine.
Good morning.
Glad to have you here. So let's start really simply and kind of define what we mean when we use the term home health.
Sure. Home health is skilled care provided to the patient in their home. And the services we provide are nursing, therapy, social work, and home care aid services. So if a nurse is needed for the patient, they generally will go in and educate the patient on their medications, their disease processes, the things they're having problems with. We can also provide skilled care such as wound care, IV therapy, and different other aspects of what needs to be done to take care of the patient. Physical therapy, occupational therapy, and speech therapy are offered through our services, as well as social work evaluations, and if a patient really needs help with a bath, we can provide home care aid services.
Okay, so you've got nursing care, which would be specifically those kinds of actual interventions that you mentioned. And then therapy, you said speech therapy, occupational, and physical therapy can come in the home. And then certainly social work. In so many cases, we need social workers to take a look at that situation and help in the home. And then a home health aide can help with things like bathing and some of those daily tasks that may be too difficult for that patient at the time.
Correct.
And so how would someone qualify into home health to get that kind of care in their home?
Sure. What we need is a doctor's order to start home care services. We would then send a nurse or therapist to the home to evaluate what's going on in the home and where we may help the patient. So once the nurse or therapist evaluates the patient and makes sure that they are homebound to receive services, then our doctors will help us to develop what plan of care they need, and then we can start services. For most of our population, homebound status is a key determining factor. Medicare requires this, and so patients coming out of the hospital who are weaker are definitely more homebound. They're not out driving in the community just yet. So home health tends to be short-term until a patient is able to meet their own needs and start driving again, maybe attend outpatient therapy.
Okay, so it's kind of a ramp. Now, is it always triggered by a hospital stay?
Not always, but we do get the majority of our patients from post-hospital stays. We can receive referrals from rehabs, SNFs, and also the physician's offices.
Okay. Now, you just said SNF. I think we want to talk about that, but from a rehabilitation facility might ask home health to be involved after that patient leaves the rehabilitation facility and goes home.
Correct.
And then SNF, that's skilled nursing facility.
So if a patient has been in a nursing home, then they want to transition back to home, we can offer our same services to help them kind of get a little stronger and be more independent.
Okay. And then, of course, we mentioned the inpatient stay at a hospital. You might have home health transitionally after you went home from the hospital. But then you said sometimes a doctor will refer someone into home health, not from a facility.
Sure. So if a patient is having problems with their blood pressure and need more frequent monitoring, then a nurse can go in several days a week, help the patient get their own blood pressure cuff, manage and monitor and write down those blood pressures, report back to the doctor, and then he can decide if a medication change is needed.
Okay. And so it sounds like there can be any number of reasons that a patient might need home health care and qualify for it. Would you say that it is costly, or how do people qualify to have it covered or paid for?
Sure. For our Medicare and managed Medicare clients, those insurances do cover home health care with no out-of-pocket to the patient, most plans. Sometimes we do have to get an authorization So we would definitely be in touch with that insurance like Humana. They may want to know ahead of time what our plan is. So if we plan on seeing the patient 4 times for a nurse and 6 times for a therapist, they want to approve that prior to us providing those services.
Okay, so depending upon where that patient came from and what their diagnosis was and what their needs are in the home, our home health team would work with their insurance to work out what the plan of care would be covered and how that would work.
Correct.
And obviously it's all overseen by that patient's doctor in terms of what they felt that the patient needed in the home.
Yes.
Okay. Let's talk for a minute too about what St. Tammany's Home Health specifically can bring into the home that maybe is a little more specialized than your average run-of-the-mill home health service.
Right now we have 3 programs that we're talking about. We have a telehealth program where we can bring in portable units to the patient's home, and they can check their vital signs, including their blood pressure and weight. And these readings are transmitted through the computer to a staffed computer that we have in our office, so we can check their vital signs on a daily basis. And this is really helpful when we see some trends that are not looking so well, that we can report that to the doctor for an immediate intervention.
Okay, so you bring technology into the home, you get set up with the patient, maybe a family member, depending on their situation, and that enables them to sort of report in daily, where with a home health nurse coming, that wouldn't happen daily.
Correct. And so we can be in touch by phone, and then if we see that the patient's really not doing well, we can do an extra visit to check on their status. And if things are going even further down, we can call the doctor and see if we can get them into the doctor right away.
Okay, so the idea there is someone, let's say, maybe had a hospital stay, possibly, let's say, for a heart procedure, and they've gone home under home health care, and they're getting better, things are looking good, but you need to make sure that their weight doesn't fluctuate because of water retention, or their blood pressure is as it's expected to be. And as long as those numbers that they're registering through the computer each day are staying stable or within a range that you know is acceptable, everything's great. But you start to see an outlier, and that's where you need to work with that patient, maybe come back out to the home. And I like the idea that that can re-engage the physician before this patient winds up coming back through the emergency department or otherwise back into the hospital.
Right. One of the big focuses on this program is to prevent rehospitalizations. So I think that it has saved a lot of people in our small company from going back to the hospital.
That is wonderful when you think about how traumatic it is for that fragile person who's, you know, got this heart condition or plenty of other conditions that maybe brought them through the hospital once, to finally get well enough to get home, to get on their way, and then to find themselves having to go back. So that's a wonderful service and a great way to use technology. I'm excited about that.
Thanks.
Now, I think there's one other specialty service that we do. Is that lymphedema?
Yes, we have a physical therapist who's specially trained in lymphedema training, and she can do an assessment and evaluate if the patient needs compression therapy or special exercises to help decrease the edema that they have.
And I think that's interesting, that word lymphedema, because a lot of people don't realize what that means. Edema simply means swelling, and so this is a swelling around lymph nodes, and it's often in the upper arms.
Arms or legs.
And legs, okay. And it's there's a certain amount of therapy that can help move that fluid along.
Right, right, yes.
And so I think it's wonderful that we've introduced that as part of our home health offerings, because that is unusual in home health care.
Yes.
Okay. Well, it's been interesting to kind of learn a little bit about home health and kind of understand how it works. It sounds like it's a transitional opportunity to get back to good health and to have some health care, nursing, therapy, social work, and an aide who are available in the home.
Yes.
Well, Christine, thank you so much for coming in. This has been really helpful to learn about home health care.
Thank you.
Thanks for coming. You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We're talking today about home-based care. We've visited with Christine Caffery about home health, And next, we'll hear from Stephanie Lawney, who'll talk with us about palliative care. We'll be right back.